Hello and welcome to another episode of the Late Aesthetics Show. Thank you so much for joining me today and welcome. I cannot wait to talk to you and to find out more about what you do in the industry and obviously to educate our listeners about what's available. So thank you for joining me.
Thank you so much for having me. I'm very excited to be here.
Amazing. So introduce yourself. Tell the listeners who you are, why you decided to get into the industry and why you love the medical aesthetics industry.
So I'm Dr. Mo. I started out my career as a dentist and then now we are where we are to where we're doing full-time aesthetics. And we're just getting bigger and bigger and now we've got a name for ourselves in the industry, which is so exciting.
Amazing. And you've probably seen the industry develop so much over the years. What was your main reason for deciding to get into this industry specifically and what do you love so much about it?
So I kind of fell into it. So I started in the NHS as a dentist and I moved on to like a max fax job in the hospital where we would treat people with like facial traumas, cancer, Bell's palsy, TMJ pain, and we'd use the products that I'm kind of using now to make them feel a lot better. And then on the side, I started my aesthetics business and then one thing led to another and we've just grown and I absolutely love my job. I get to see new people every day. Everyone's so happy to come and see me. Everyone leaves feeling incredible. So there's such a good atmosphere in the clinic, which is amazing.
Amazing. And one of your main skills and one of the things I think you're best known for in the industry is non-surgical rhinoplasty.
Correct.
When I've spoke to people about non-surgical rhinoplasty, they're like, what is that?
Yeah.
So what is it?
Very, very simple idea. So everyone always thinks you can only have your nose treated with surgery to make it lifted, dropped, whatever you want to do. But there are some specific things that we would use filler to treat that. So it's super easy, super quick. It's a 5-minute procedure. You have it done in your lunchtime. And I can get in a lot of people very similar results to what you could get surgically. Yeah. Not in everyone. Yeah. Not everyone's suitable for the treatment, but a lot of people are. And I get surgeons send people to me all the time for this treatment because they just don't need the surgery.
And is it painful? How long does it last?
It's really not painful. Like I said, it's a 5-minute procedure. We use a super, super strong numbing cream, which makes it feels nothing more than having your eyebrows plucked, if that. Okay. And the main things we can do are side profile changes, so little humps and bumps within the nose. I can lift those to straighten them, and the tip I can make look a little bit more lifted. So my ideal nose would look either nice and straight from the side or straight and slightly lifted, which everybody loves.
And I think the nose, it makes such a difference to like facial harmony. It makes a very big difference to how the structure of the face works. So it's such an integral part. And I think for so many years, people only thought there was a surgical option. They thought they're going to have to get their nose chiseled down, go through all the downtime, the pain, the recovery process. But yeah, I mean, the fact that we can do non-surgical rhinoplasty is amazing. Is it quite a dangerous procedure? I mean, are there any, obviously, like anything non-invasive, there's always a risk involved. Is it dangerous?
Absolutely. So I always tell everybody, any treatments I do, doesn't matter if it's a nose, if it's a lip, anywhere I'm treating, there are dangers involved. There are risks. As soon as you sit in my chair, you have to take that risk on. However, from my side, I make sure we're using safe products, we're using the correct needles, we're injecting the right places. I know exactly where anatomy is. I've been in this industry for 10 years and touch wood, wherever the wood is.
Yeah.
I've never had a complication, which is absolutely incredible. And I've done thousands of noses. So there is loads of stuff out there where people are like scaring people about treatments, which is fine. As long as you're going to someone who knows what they're doing, where they're injecting, knows anatomy, it's pretty safe.
And do you think that these types of procedures should only be carried out by a medical professional? Or because, as our listeners will know, the industry in the UK is not regulated, which I personally think is a big problem. I'm a big advocate for safety and regulation in the industry. So do you think a procedure that carries such a high risk, such as a non-surgical rhinoplasty, should be performed only by medics? And do you think the industry needs to head towards regulation?
We definitely need to head towards regulation. It is crazy out there. It's the wild, wild west out there. I know people who are training the same day, done maybe one injection in a nose, not even a full nose. Then that afternoon, they can go home and they can start injecting people, which is mind-blowing. And it really comes down to the government. It's not these people's fault. These people are taking the opportunity to make some money, get in the industry, build a career. And I really don't blame them for it. The problem comes down to the government. And I personally have emailed health secretaries and MPs and stuff like that. I've had no response from anyone about it. I know there's stuff happening in the background, But it's really hard to know where that would go. And it really needs people like me in the industry to be involved in those discussions, because I don't know who's in these discussions. I don't know who's making these decisions for everybody. But yes, there needs to be regulation within training in particular. So these training companies, even medical and non-medical training companies, need to be held accountable for what they're telling people to do and what they're giving certificates out for. And insurance companies are giving insurance to these people, which is absolutely mind-blowing.
And it takes more to, let's say, open a kebab shop in the UK than it actually does to start injecting somebody's face. And when you actually put it into context like that, it's ridiculous.
Which is crazy. And compared to other countries, some other countries where we might look our noses down at for other treatments, they have much, much better regulations than we do. In some places, I would struggle to inject for some areas, which is, again, crazy. And that's how it should be, and that's where we should go down. Everyone should be registered, we should be regulated, someone should be looking at you at all times, and you should have to answer to someone. If you damage someone, you can ruin someone's life with these treatments.
Well, that's the thing. And obviously, there's a lot more risk for medical professionals because they have their regulatory bodies.
Absolutely.
So there's obviously the GMC, which is like doctors, the GDC, which obviously looks after dentists, and then the NMC for nurses and midwives. So there's a lot more risk, let's say, if you were to do something wrong than it would be, let's say, for just any bystander on the street that decides to, because they've got no one to answer to. No one's reinforcing anything or like giving them any sort of like investigation if something was to go wrong. So there's a lot more risk for medics, actually.
There is. I'm very, very cautious about the type of patient I treat, how I treat them, the aftercare, how I treat them beforehand, because I know if something goes wrong, that's on me. And if that's on me, I lose everything.
Yeah.
That person who's done that one-day course, nothing's going to happen to them. They just go home,
Exactly.
shut shop. That's the end of that.
Well, that's it. And if there's a complication, they literally don't reply to your messages.
Yeah.
They say that's not my problem. Go to A&E. But what's A&E going to do if there's a complication?
This is the other problem, is exactly that. A&E don't actually know how to treat these cases. I've had calls from my friends, doctors who are in A&E, who are like, right, I've got this patient, this has happened, what do I do? I'm like, this is crazy that I'm having to give you advice on how to treat this kind of thing.
Yeah.
But if you're seen by a medical practitioner, they'll be able to deal with those complications for you within their clinic at that time.
And that's what I think that's what people need to remember. That's what they're paying for. They're not just paying for a syringe, a vial. They're not paying for that. They're paying for the expertise and the fact that if there is something to go wrong, the risk will be able to be managed.
Absolutely. So if you come and see me, my prices are probably going to be a lot higher than someone who's not regulated, because they're not paying for their regulation. They haven't gone through 5 years of medical dental school and all that training, and all the regulation that goes around it. But with me, I know you're going to be safe.
Yeah.
With someone else who isn't trained to that level, you're putting yourself at risk, which makes no sense to me. It's your face. This could change your life. It's crazy.
You only have one face, I always say.
Exactly.
Why risk it?
You can't get a head transplant.
No, you can't.
It's not going to work.
It's not going to work. I think there's a massive difference between somebody like yourself that literally studies facial anatomy for years to get your degree than somebody who goes on a weekend course. Or I think there's even online theory courses that you can do now.
Absolutely mind-blowing. So yeah, as part of my studies, we spent a whole year just doing anatomy. I was there cutting up people, looking at all these anatomical layers. I know what's there when I'm injecting. I've seen it in real life. I've peeled back, I've cut, I've dissected all these things. I've done exams after exams after exams and read books and books and books about your anatomy.
Yeah.
These people are going on one-day course. How can you learn what I know in that one day? If you can, fair play to you. That's incredible. But I'm sure it's not happening.
It's not happening at all. Like, it just doesn't happen. And obviously, you've got to think about the experience as well. That's factored in. How many, let's say, non-surgical nose jobs have you done? Probably hundreds.
Thousands.
Literally.
Yeah.
So your experience with what you're doing. I'm a non-medic. I would never even think about picking up a needle and putting it near somebody's face because I wouldn't have a clue what I'm doing. And it would actually scare me a lot because it's your face and a needle.
But that's the problem. These people don't have that fear because they haven't been in the medical environment. They don't know the complications and how ill and things can happen. Yeah. It's even like being sterile. It's so important. People like reusing needles and all doing all that kind of stuff. You don't know what that can lead to. And because they're blind to that, that doesn't make them fearful. I'm way, way more fearful doing things. I'm like, I know the complications that can potentially happen.
Yeah.
Even if I'm following every single protocol, you can still get complications.
Yeah.
And medics get complications, and non-medics get complications. Like medics might do some dodgy stuff as well. Non-medics will be doing dodgy stuff. It's not just one person, but we just need to make sure that there is great regulation across the board and make sure we're setting people to do treatments within their training and within their capabilities long term.
Absolutely. It's about elevating the standards of the whole medical aesthetics industry.
Absolutely.
It's a part of medicine, and that should never, ever be forgotten.
Agreed.
There's a lot of nice, new, exciting things happening in the industry.
Yes.
There's a lot of talk about like biostimulators, like exosomes, polynucleotides. Have you brought anything new into the clinic recently, like let's say in 2024, that has really excited you? And where do you, let's say, see the industry moving in kind of like the next 5 years' time?
The industry is moving completely differently. The kind of things I'm doing now is very, very different to what I was doing before. Before we were just like filling people, trying to use filler to treat every concern, which is not what we should have been doing. And we've moved way more to skin. I'm doing way more skin treatments than I've ever done before, which is incredible because that is just the bread and butter of everything else. As when your skin is sorted, everything else looks much, much better. So we are definitely moving to biostimulation and all that kind of stuff. People are a lot more interested in natural and making your own body heal and produce its own collagen, elastin, and all that wonderful stuff. So the polynucleotides are massive at the moment, huge, and they're lovely, they're great. I always say to my clients, they're not life-changing. You're not going to get that result where you leave the clinic, you're like, oh my God, my lips look bigger, I look incredible, or your Botox settled down and everything looks absolutely smooth and glowing. Yeah. It's not that. Yeah. We are moving completely different direction where it's a slow process. It's an investment long-term to try and maintain your skin and get results over a long period of time. Some of the problems I have, for example, with polynucleotides are people think they're going to come and have their eyes injected and they're going to get rid of their puffiness, they're going to get rid of their dark circles, everything's going to lift and it's going to be incredible. It's not. That's a lie. Yeah. But what we can do with them is we can make you produce a load of collagen, we can make you produce a load of elastin. Alongside your topical skincare, your retinoids, your vitamin Cs, we're going to sandwich all that, we're going to treat from underneath, we're going to treat from above, and things will improve. It's also about setting expectations about how much they're going to improve. Because people just see on social media these before and afters, which are with incredible lighting in different positions. We all know.
That was it.
We all know how to take those pictures. Yeah. I know how to make everyone look better with slightly changing lighting. And that's one of the problems with social media I have, is people's expectations change dramatically.
And do you think that they're unrealistic? Do patients have unrealistic expectations?
100%. I see it all the time in my clinic. On my social media, I do try and debunk those. Yeah. Like, you'll see all my posts about polynucleotides are like, yeah, they're amazing. They'll make you produce a load of collagen, incredible stuff. Can't say better things about them. But then they might not do what you think they're going to do because you've been missold something.
Well, this is why you need to come for a consultation.
Absolutely.
I always say, if you're not having a consultation before a treatment plan, you're going to the wrong person. Yeah. You need a thorough consultation. Absolutely. And it's not just a one treatment thing. One treatment's not going to fix you. It's a journey that you need to take the patient on.
Absolutely.
Whether that's for face or body treatments. It's not like you're just going to cleanse your face once or have one treatment and then all of a sudden you're going to look completely different.
No.
It's like anything. How you do anything, you do everything. So I think if you want to improve your overall skin health, and I do think people forget that the skin is the largest organ in the body. Yeah. And then what happens is when people start noticing the visible signs of aging, they think, shit, I need to do something about it.
Yeah.
But it's not. It's a continuous process. It's like if you only ate healthy once. Yeah. It's not going to change.
It's not. It's a long-term thing. So when I get people on their skin journey, I'll tell them this is going to take us a year to really get you to optimum, where we will do an injectable home skincare. And your home skincare changes as well. That you don't just stay on one thing. We add things, we change things, we go up with percentages. It's seeing us for regular facials, peels, needling, whatever all that kind of stuff is, to really get you to the best you can possibly be. It's not a one-trick pony.
And skin cycling was quite a big trending topic. I think it was a few months ago. It was quite trending on TikTok. And it was, I think the concept behind it was use different products on different days. Mm-hmm. But it's the same concept with, let's say, in like summer months and winter months. Like you may not use a retinoid during the summer months because, you know, you've got more UV exposure. So how do you feel about skin cycling? Would that be something that you would recommend to your patients?
Yeah, to most people, except retinoids. It depends what kind of retinoids you're using, actually. I always make sure if my clients are on skincare, they're using good quality SPF. If you're using good quality SPF, you can put whatever on you want. Absolutely no problems. If you're going on holiday, you are oiling yourself, and then you're going to use retinol. I'm going to say, please don't do that. Maybe go off for the summer and then come back when you're hiding yourself again. But yeah, skin cycling, I'm not against at all. But everyone is so different, and that's where the consultation comes in, and that's how I will physically, and one of my skin therapists will physically change your plans as time goes on, and your skin changes over time as well.
Yeah.
So we might actually go stronger with things. We might be like, actually, your skin, this is happening now, so let's take that away, let's add that in. So that's really, really important.
It's kind of like working out. If you just did the same workout plan, you're not going to see any changes,
No.
and it's the exact same with the skin.
Absolutely.
You do need to tweak it sometimes. You mentioned retinoids.
Yes.
I think there's so many myths about retinoids. People
I deal with that
them.
every day. Everyone is scared of retinol. You do not need to be scared of retinol. If you're using the right brands, you're using it in the correct way, you're combining it with other treatments and other topical stuff, you do not need to be scared. You will not peel, you will not go red, you will not break out. You don't have to go through that. If you start super strong, of course you will. Everything's going to break out, your skin's going to peel off, it's going to feel horrendous for a couple of months before it glows. But you don't have to do it that way. If you go and speak to someone who knows what they're doing, they can start you really low and then you work up, and you will never, ever, ever have that. That's what I always say to my clients. I can guarantee you will not get the purge, you will not get the peeling. That won't happen if you don't want that to happen. I can manage that as long as you just follow my rules. But there are so many myths about retinol, and it is extremely annoying.
Well, this is, again, why you need a consultation.
Yeah.
And I always say to people, please don't go to Boots and buy a retinol.
Please don't.
I'm just not calling out Boots, but like over-the-counter type products,
yeah.
please don't. You're wasting your time, you're wasting your money. They're not effective in your skincare routine whatsoever.
Agreed. And one of the troubles is some of the really good ones are very, very expensive, and it's not in everybody's budget. But there are other ones as well. There are, for example, the Medik8 ones. I absolutely love the Medik8 retinols. I actually think they're better than most brands out there. And that is stuff that you can buy online, and it is incredible. But again, you've got to be careful with that, because they've got an incredible ladder. You start super slow before you move up. But again, go see someone, have a consultation. They'll tell you what to do based on your skincare concerns.
And starting a skincare routine can be very daunting. It can be very, very confusing.
Yeah.
I think at one time I was using like 8 products in my skincare routine, and I was like, this is ridiculous.
Yeah.
I can't be bothered using 8 products.
I can't. I don't.
I don't either.
No.
I use 4 maximum.
Yeah, I'm about 4.
Always SPF. Never, ever, ever, ever leave the house without SPF.
Ever. Do you know what I always say to my patients? SPF, think of it as moisturizer. Do not think of it as SPF. So it means you do not leave your house without it.
Yeah.
If it's grey, if it's sunny, if it's cloudy, if it's thunder, it's a moisturizer. Think about it as a moisturizer. Don't think about it as an SPF. And that will just get you over that hurdle.
A thing that I've always remembered with SPF, it's like going outside the house with no clothes on. You would never do that, right?
I like
So
it.
it's the same with SPF. Never, ever leave the
Never.
house without SPF on. What do you say to people that turn around and say, well, I have SPF in my foundation, so it's fine.
I literally had that yesterday.
What's your answer?
She was like, I've used that Nivea, like it's like a glow and a bit of moisturizer, but I want to start using retinol. I was like, okay, let's
Interesting.
take
backtrack
this
a little
back.
bit.
Please take this with you. Yeah, it's crazy.
Yeah.
But again, that's not the client's fault. That is, they've been sold that by those companies. Like, right, we'll put a bit of SPF in here that protects you. It's obviously not.
It's not enough.
It's never enough.
Top tip for SPF, what should the consumer be looking out for when selecting an SPF?
Again, depending on your skin type, we've got chemical ones, we've got physical ones. And again, there's so much out there about those things. People are scared to use like chemical ones against physical ones, which is crazy. But go see someone and they will tell you the best one for you. It's as simple as that.
Yeah. But don't just go see any random person. I always
Gotcha.
think, like, you do your research about the clinic.
Yeah.
Do your research about the practitioner. Are they a medical professional? How long have they been practicing?
Yeah.
Do they use like specific brands? These are all factors. And I sometimes think it's not a bad idea to have multiple consultations.
Absolutely not. And I actually don't think I'm the best person to come get a skin consultation from. I do a skin consultation and I can do the basic. I tell you this is what you need to use because I've done the training, I've used it myself. But actually, skin therapists are probably going to be way better at putting you on a plan than I ever will be. I give them a plan. I send them then out to my reception where I've always got a skin therapist there. And she will tweak it, and sometimes she changes it completely.
Yeah.
And I'm like, what did you do? She's like, I did this. I was like, that makes sense.
Yeah.
So yeah, it doesn't have to be someone like me you need to go see.
Yeah.
Skin therapists who are trained in skin and are working with these companies to looking at their research and all that kind of stuff might actually sometimes be better, apart from maybe a dermatologist. If you've got like serious concerns or cystic acne, that kind of stuff, I do send my clients to dermatologists as well to really control things before I take over.
But it's like a GP is a general practitioner, so they're not specialised in every single field of medicine.
Absolutely.
So you need to really see someone specific in the aesthetic medicine industry, and that is, that's their core, focus. It's their core skill that they do aesthetic medicine.
Great. And it's like facials. You would never want me to do a facial. Like, I've done it now and again, and I can just about get through it. Yeah. I'm terrible at it. I don't do it. It's not just, don't ask me for a facial. It's not going to work. I've got someone who is specialised doing it all day, every day, completely trained as a skin therapist. She knows exactly how to treat your skin.
Exactly.
So yeah, it's not specific. You don't have to be seeing a medic all the time for all of these treatments. For injectable stuff, ideally, yes. But for all other things, there are other people who can be just as trained, if not better trained.
Absolutely. You've got an exciting new development happening in clinic.
Yes.
Tell me more about that.
It's actually a little bit top secret, so I can't say too much about it. It is going to change the industry, though. So
just a little bit of
we will tell you something, because we have got it in clinic and we are using it, and it's incredible. So we find people who are super sensitive to pain, just not good with me doing any injections, including Botox. I tell people Botox is painless because it is. It really is. But some people are super scared, a little bit dramatic, and they've just got a really, really low pain threshold, which is absolutely fine. And not just any treatments that we do, there is some pain involved. All the treatments I do, there's needles, there's injections, there's pain. So we've been using like the EMLA creams, the LMX, all that kind of stuff, which is fine. But recently we've been trying something new, something very, very, very concentrated. It will be prescription only. And we've been using it for all our treatments. I can now say to people, you can have lip filler with us without it being painful with topical numbing cream. So that is coming very soon. I can't say much more about it because someone will kill me.
That's okay.
But that's coming.
That's really exciting.
Very exciting.
Because I've had patients ask before, does Botox hurt? Or can you put some numbing cream on before? But I'm like, it literally takes 2 minutes.
And it's not painful. Do you know, most of my clients are absolutely fine. I've only got, I think, 2 who have numbing cream for Botox, and that's fine if that's what you want. That's okay. One of them the other day, I did a Botox. I was like, why don't you just have a go? And then I did it. She was like, that felt exactly the same as with numbing. I was like, yes, I know.
But I also think it comes down to the injector.
Yeah.
Because it's a skill.
Agreed.
There's people that are very, very heavy-handed, and if you've been to them in the past, you may have had a bad experience.
I've had it.
It's maybe people that don't have as much experience, because you can't put a price on experience.
That, and sometimes the products. Some products actually hurt a lot more than other products. And the way, for example, Botox, the way you mix your Botox really changes how painful that is. The saline that you use to mix your Botox will take it from a 2 out of 10 pain to a 10 out of 10 pain. Yeah. So if you're using really cheap saline, it's going to be painful. If you're using the good stuff, it's going to be painless. So that does definitely change things. Because I've done that before, where the really good saline actually goes out of stock quite often. So now I buy thousands. Honestly, the amount there is in my clinic, I'll stock up. Because when that goes out, you have to use the other stuff. Yeah. And every time I've done that, everyone's like, Mo, why is this so painful today? And I'm like, I know exactly why. I'm so sorry. But now I'm never out of stock now. Ever. So
your patients do not need to worry
never.
about that. Just going back to the polynucleotides, they're quite painful. Like I've found,
Interesting.
I had 3 sessions around my eyes, not painful whatsoever. Then I had 1 session lower face, and I think it's maybe because the skin's tougher on the lower part of the face. And it stings, like, when it, obviously because it's salmon sperm, right?
Yeah.
It's the seawater that stings.
It's salmon sperm. Salmon sperm, yes. No, so what that is, actually, every client who's been somewhere else, that polynucleotide, they come back, they're like, that was so painful. I was like, that's really weird, because none of my patients ever complained about pain with polynucleotides.
Right.
And I've only this week worked out why. So the needles that you use for salmon sperm injections can be super, super, super thin because it's a really lightweight product. So I use a 34 gauge needles for those medics listening. That's what I would advise. And I can guarantee you it is painless with that needle. Not all companies make them. So the company I use for polynucleotides are called Vitaran. So they come with a 34 gauge needle, and everyone always says how painless it is. So that is the main issue.
Amazing.
There you go.
That's a little top tip. That is a Dr. Mo top tip.
Ask your practitioner for a 34 gauge needle.
Imagine
They'll probably want to kill you.
Yeah, please can I use make sure you use a 34 gauge needle today. I've been listening.
Yeah, they're not that easy to get 34 gauge needles, so don't be surprised.
Yeah, because you've probably got all the stock of it. That'll be why.
I've got the stock, all the UK stock in my clinic.
Exactly. Well, thank you so much for joining me on the podcast today.
Thank you for having me.
If anyone has any questions or wants to contact Dr. Mo for any treatments or guidance, or wants to improve something that's been bothering them, please give him a follow and give him a DM. You're happy with people DMing you?
Yeah, I won't be answering the DMs. My girls will be, but yes. Send a DM, send an email. The girls get back to you. They're amazing. Amazing.
And any comments, and please make sure that you subscribe and follow for more content.
Amazing.
Thank you so much.
Thank you.